So I'm really privileged that you took the time to join me and George. I am going to be talking about policing the overdose crisis. What I'm going to do is go through about 8 significant trends that really shaped the number of drug overdoses that we have seen here in British Columbia and Western Canada. And then toward the end, I'm going to talk a little bit about how police pivoted towards harm reduction. But the majority of this talk will be about setting the scene for what has been a catastrophic experience for many of us involved in the overdose responses, first responders and beyond. So with that, I'll share my screen. Hopefully this all works. Maybe George can let me know if everything looks good.
Looks great. Go ahead.
So I wanted to start by having you take a look at this photograph. Now, you're going to see 4 police officers standing beside some green tarps. There's some caution tape. This is in an alleyway. It's beside a couple of dumpsters. This is a photograph of one of thousands of drug overdose scenes that police officers have attended and first responders have attended over the last 10 years. Why this one? Why did I photograph this one? Why does this stand out to me, and what does it mean? I actually took this photograph from the office, through the window of my office at Victoria Police Headquarters. I was sitting reading coroner's reports when I heard on the radio that there was a fatal drug overdose directly across the street from the police headquarters. I went and talked to the officers. It was a 22-year-old woman who had died. She was trying to access a site that provided safe use supplies a block away. It hadn't opened yet, and she used behind the alleyway. For me, it was a tragic reminder that these are real people. This is a widespread situation, and if somebody can die across the street from the police department, then we are not helping people. We're not doing the right thing here. But before we get to that, let me talk about the trends that we have been seeing in British Columbia over the last 10 years. And I will just say this, that this information is born out of my experience in Victoria, where we are the 3rd hardest hit city per capita when it comes to fatal drug overdoses in Canada. And we've seen a 650% increase in drug overdose fatalities in the last 10 years. George and I didn't cover this. Feel free to put questions in the chat if you would like, and George can read them and fire them out as we go. Or if you prefer, feel free to ask questions at the end of my presentation. So everybody has heard of fentanyl, but before we were dealing with fentanyl, I'm going to tell you about trend number 1 that we saw in law enforcement, and that was the global switch to Afghanistan production of opium. Afghanistan was always an opium producer, but through the course, if you look at that bar graph, through the course of 1980, you see the light blue growing to 2009. Afghanistan became the lead country in opium production, and likely everybody on this presentation knows that it is from opium that you get heroin. So you see that red circled area, that's where opium production in Afghanistan really exploded. Why does that matter? What did that mean to us? Well, the thing is that the heroin produced from Afghanistan-sourced opium was time and time again more potent than heroin from Mexico or heroin from Colombia, where a lot of North American heroin comes from. So before we even had fentanyl, we were already dealing with this strange situation of an increased number of drug overdoses based on the increased purity of the heroin. Now, I've also got a red arrow on that little graph, and I'm going to let you think about that for a second. And then maybe at the end of the presentation, I would love if somebody could tell me why it is, beside that red arrow, in 2001, there was what I would call a collapse in the opium production. So I'll leave that for later. So that more potent Afghanistan heroin arrived in Canada. It looked just like what you see here. This was stuff seized back in that time frame. We called it pebbles or PEBs, this brown kind of crumbly heroin. like I said, we were already trying to figure out what was going on with the heroin situation, and this looked different than what we had been accustomed to seeing. What we had seen before was more of that traditional brownie powder, and this stuff was new to us. That really matters because when you think about it, the heroin that came from Afghanistan, the only thing we kind of had going for us was it was coming from a long way away. Now you can see the red circle with Afghanistan. That heroin would have traveled through Europe onto container ships, or would have got to us via people packing it in suitcases and then flying on domestic or international flights, arriving in Toronto, Halifax, Ontario, Vancouver, and then making its way onto the streets. What we had going for us was that's a long way for heroin to have to be trafficked. But in any event, even though it was a long way away, we were already, as I mentioned, seeing this impact. So if you look at that red oval, you can see that from 2009 until 2013, you were pre-fentanyl, definitely pre-fentanyl, we were already seeing a significant increase in fatal overdoses. So 2009, you're looking at 201. 2013, you're up to 334. Now, this complicated things for us because when fentanyl arrived, we didn't really understand its initial impact because we were already seeing an increase in overdoses caused by something entirely different. So that's why this really matters to us, because it's certainly in my profession, potentially in your profession as well, there's what you know at the time, and then there's what you know years later when you look back at the time. And this is one of those things where we didn't understand it when we were in it. It took being out of it for a couple of years before we looked back and we realized that we missed the impact of fentanyl early on because of the situation with the Afghanistan sourced heroin. So trend number two, the significant trend, of course, that we're all painfully aware of, is the arrival of illicit fentanyl into North America. So I remember first seeing this DEA bulletin from 2015, but by that point, it was already old news for us. And that's a significant point I want to reinforce, is that Victoria, Vancouver, Western Canada, we were really at the very cutting edge, for lack of a better term, cutting edge at the arrival of fentanyl. It was in 2013 that we first detected it here in Victoria, and that was through the course of an undercover drug purchase where we had sent officers out to try to purchase heroin from an organized crime group and some of the people they had working for them at the street level. When we came back with what we thought was heroin samples, we sent it for analysis only to discover that it was fentanyl. And at the time, I remember thinking to myself, where is this fentanyl coming from? And by where is it coming from, I thought, which pharmacy or which diverted medicine is this coming from? We did not have, at the time, a good understanding that this illicit fentanyl was in fact coming from China. We soon realized that we were in for a terrible surprise. So, as many of you may know, at that time, we were able to establish that the fentanyl was being manufactured in newly formed chemical laboratories in China. So I had the opportunity to meet with a member of the Drug Enforcement Administration stationed in Beijing near this time. And he explained to me that there was something in the neighborhood, as best as they could tell, of about 30,000 chemical manufacturers that were now producing fentanyl solely for the purpose of shipping it to the North American market. And again, this graph is dated 2016. It took a couple of years of this happening through 2015, 2016 for us to recognize what was going on. When we looked at it up close, this is the kind of thing that we saw. So this is an actual kilogram of fentanyl that was seized at the Vancouver Mail Clearing Center, which is located at the Vancouver International Airport. And it was destined for a small apartment building in Victoria. When CBSA agents intercepted it, what they do is they turn that over to the police of jurisdiction. So they turned it over to us because on this occasion we were going to pursue an investigation. We created a package that resembled this package and delivered it without any fentanyl inside, of course. And through the delivery of that package, we were able to track down the organized crime group that were responsible for trying to import this fentanyl. So with those packages arriving, and there were more than we could ever truly intercept. If you think about it for a second, when people say, why can't you intercept these packages? Well, we can't, because when you think of the volume of products that we are buying from, say, Amazon that are being shipped over from China, there are thousands and thousands, in fact, hundreds of thousands in a week. And so those packages were inevitably slipping through the efforts to stop them at the border. So that led to trend number 3. With all that fentanyl coming in, the first thing we saw was the combination of fentanyl with heroin. And this is an actual photograph of that happening in and around Vancouver in a mixing operation in somebody's apartment, where the white powder is the fentanyl, and that brown powder is, much like I showed you already, is the pebbles type of heroin. In this case, it would be a fairly low dose or fairly not pure heroin sample mixed with fentanyl to provide that boost of euphoric effect. But this also had another advantage for drug dealers, which I'm going to hopefully explain here. So if you look at this graph, this is from the science of anesthesiology, and it shows the initial impact of certain types of drugs on the human brain. I've put a red arrow here to show you the impact of fentanyl when it first hits the brain. You can see, if you look at the bottom of this graph, that in less than 5 minutes, fentanyl peaks in its impact in the brain. It peaks in that euphoric effect and that anesthetic effect, the analgesic effect, and then it wears off very quickly. Within 30 minutes, it's decreased in its potency by about 50%. That's not what drug dealers wanted to provide it to their customers. They wanted to provide something that customers are going to say, well, this is as good as the heroin that I used to use, not something they were going to say, this wears off really fast. So the combination of fentanyl and heroin provided this kind of effect, where this graph uses morphine, but as many of you probably know, when heroin is ingested, it converts from heroin into morphine in the human brain. So morphine is a good representative of how long these euphoric effects are going to last for. So you can see while the fentanyl is providing that peak bolus effect, or that peak initial effect, it wears off pretty fast. But then you've got the heroin, or in this case the morphine, which 30 minutes later it's still trending upwards with the effects on the brain. So that combination of fentanyl and heroin was basically the go-to combination in the illicit drug market. And this is how we would see it trafficked. So I explained to you that we intercepted that box of fentanyl. When we executed a search warrant at the house where that box was going to, this was what they had already received in prior shipments. This is thousands of heroin flaps that were already made up. And these are lotto paper. If you don't know what this is, it's lotto paper that you can pick up at like 7-Eleven. There were thousands of these, and these ones were mixed with, of course, heroin, in this case, furanyl fentanyl, ready for street sale at $20 a pop. So what did that mean for us? Of course, that meant a couple of press clippings here. Terrible, terrible impact when it came to a sudden spike in overdose deaths. 8 dead in Victoria in 1 week, 13 across British Columbia, 9 in Vancouver. There are so many stories like this, but I just picked a couple to show you, of course, what we were dealing with at the time and trying to grapple with what to do. And of course, across the province, anybody who works in this field, of course, probably has looked at this chart so many times. You're probably tired of looking at it. But in any event, there's the red circle that shows 2015 to 2018. You see that rapid increase in fatal overdoses. Trend number 4 came along in May of 2019. Now, this was something that was in the works for so long. And that was that the US government, the Canadian government, the Department of Foreign Affairs were working with the Chinese authorities to try to get them to ban fentanyl, to ban analogues and precursors. So Before this, fentanyl and the analogs were not regulated in China, meaning that the organized crime groups there, or even just the chemical manufacturers, were running amok, and as I mentioned, 30,000 labs or more producing fentanyl. Finally, they acquiesced and they banned fentanyl and analogs, etc. This was a famous photograph of a trial of 9 fentanyl manufacturers, 8 of which were sentenced to life sentences, and 1 which was sentenced to the death sentence. So they took it seriously. Fentanyl became banned in China. And while we know definitely some fentanyl was still produced there, there was a marked shift away from the actual fentanyl production to what I'm calling trend number 5, which was a shift to precursor and masked precursors trafficked from China. So a masked precursor is just a chemical that's basically a disguised scheduled substance. It can be easily converted into the actual precursor. So this image that I'm showing you, this is not, as you can see, from the dark web. This is just from Alibaba, which in China is really a powerhouse as far as the internet selling platform. And this is easy to see for yourself that there are thousands and thousands of chemical companies still selling precursors sourced out of China. And so I've got this little red box at the bottom, and I really wanted to draw your attention to that this isn't a lecture about the role of the internet in drug trafficking, but the role of the internet in drug trafficking is a complete game changer. It has connected buyers and sellers globally. And it is virtually impossible for police to police the internet and the trafficking of drugs and precursors via internet sales. The use of cryptocurrency, the regular internet, and then the dark web is tackled time and time again by agencies like the FBI. And as soon as they shut down one site, another site opens up. So, but even on something like Alibaba, there are thousands of sales for precursors. So what is the impact of the precursors? Which leads to trend number 6, which is the domestic production in Canada. So we have seen an explosion of domestic production where we didn't see much at all by way of domestic production. A few labs here and there, but after 2019, we saw a couple of things. We saw a significant decrease in fentanyl actually arriving at the border, being intercepted at the Vancouver Mail Clearing Center. And we saw the influx of thousands of kilograms of precursors, and then they are being smuggled to domestic laboratories all over places like the lower mainland of British Columbia and Alberta. This is a photograph from an actual fentanyl laboratory taken in a suburb of Vancouver, and the investigators, when they looked at the precursors that they seized, they came to the conclusion that this would have produced 27 kilograms of fentanyl. They think that there were many successful cooks, they would call it, and that this particular laboratory would have produced thousands and thousands of kilograms of fentanyl prior to the intervention of the RCMP. So what are the results of domestic production? Well, certainly we have seen an increased availability with the clandestine laboratories, like I mentioned, all across British Columbia and Alberta. So you got to think about it for a second. Prior to the fentanyl being made locally, it had to be brought over from China, whether that be by something like UPS or Canada Post. I showed you the Canada Post photograph. But still, that's a long way to travel. There are measures at the border to try to intercept some. All that changed when all of a sudden the laboratories are located in places, like I said, the lower mainland, whether that be as far out as Chilliwack or Agassiz, 100 Mile House, all locations where we have found fentanyl laboratories. And they're able to produce it in extremely large quantities. They don't have to worry about sending it across the Pacific Ocean. It can be brought out the laboratory door and distributed into the city where the laboratory is located, literally within hours. So this photograph that you see is of a seizure of over 10 kilograms of fentanyl. 10 kilograms of fentanyl seized 4 or 5 years ago would have been a very, very big deal for police, and now this is a weekly, sadly, a weekly occurrence. Decreased price for dealers. With more availability, the price of fentanyl for dealers. So obviously there's a hierarchy of drug traffickers, and the producers are going to be working for high-level organized crime groups. They're going to have a network of dealers that either deal directly for them, or they're like contracted, or they are selling some of the fentanyl to groups of dealers. Their prices that they're paying are a lot less than they ever used to be, tens of thousands of dollars less. Which means that there is just more availability for dealers to purchase this fentanyl locally produced and then put it out onto the street. So we're seeing more fentanyl than we have ever seen before. More fentanyl than we have ever seen before. I want you to let the irony sink in for a second, because we worked really hard to get China to stop producing fentanyl, and they have, because of regulation to a certain extent, but yet here we are in this situation. So many times in law enforcement and in drug enforcement, we see these unintended consequences, and the unintended consequence of this is now more fentanyl than we've ever seen before because of domestic production. Increased purity. So with that glut in the market for fentanyl of fentanyl, there's less need to adulterate it with other substances that are other opioid-like substances. It is hitting the street in a greater purity, which means greater toxicity. And in fact, a Conor study shows extreme fentanyl concentrations have doubled in postmortem examinations. The question we're asking ourselves, law enforcement, is, will Canada become a source country for fentanyl production? So trend number 7. Fentanyl is now outpacing heroin as a primary opioid. So this data that I'm showing you is from Health Canada, and this is the yellow arrow, of course, is fentanyl at over 4,000 samples, and the red arrow is heroin seized during the same time. This is about the first 6 months of 2021. So fentanyl seizures are 8 times greater than heroin. Basically, in policing, we're trying to get a handle on whether the heroin market has collapsed in Western Canada. Trend number 8 really is linked to the lack of heroin availability, which means benzodiazepines are now being combined with fentanyl. So I want to introduce you, if you don't already know, to itizolam, which is, when you look at your screen, it's on the bar to the left, and there's the red arrow pointing to itizolam. Itizolam is an analog of benzodiazepines, and benzodiazepines are like a sedative drug that people would use to treat anxiety. What's going on now is, because drug dealing organizations can't get access to heroin like they used to, because fentanyl has replaced heroin as that primary opioid, they are using benzodiazepines to do what I explained before, which is to provide that longevity of that drug use. So again, when I showed you the graph with that early peak, the graph on the right with that early peak of fentanyl, 5 minutes after it's introduced into the body, it peaks and then wears off. The yellow arrow shows it wears off in 30 minutes. If I put a big X over the morphine, take that out of the equation, and you're going to have fentanyl without any sort of longevity to it. We do see lots of that, fentanyl combined with caffeine, but that's not really what people want. People do buy it, and they do want fentanyl, but they want something with longevity. With no heroin to put into it for that longevity, organized crime groups are buying itizolam, which you can see in the lower part of your screen, can be bought online. It's very, very cheap to purchase, this benzodiazepine analog. And it's got the half-life of something like 7 to 15 hours. So fentanyl combined with itizolam provides that longevity that heroin used to provide. So the impact of benzodiazepines in fentanyl, we're seeing it right across Canada. This is just a little picture, news story from Ontario. I just circled where at the bottom where you see that it's attributed, overdose spike is being attributed to itizolam. From purple, heroin. Well, the purple heroin, we're seizing that here in Victoria as well. It's actually fentanyl combined with etizolame. That's produced in Vancouver, that purple fentanyl that you're seeing. Purple because it's being colored with vape juice from that juice from the vape pens. Another strange trend in drug trafficking and fentanyl trafficking is to color it to provide this sort of a marketability and uniqueness. The impact is the complex overdose, or the impact, sorry, is that overdoses are becoming increasingly complex to treat medicinally because of a combined opioid and benzodiazepine, very difficult to treat, and they're playing etizolame is playing an outsized role in overdose deaths. In fact, when you look at this graph, you can see that just in 2020 alone, when you look at July through December, these are the drugs that are playing a role in toxicity that are being found in postmortem examinations. And when you look at, I've circled benzodiazepines, look at the growth in the presence of benzodiazepines in postmortem examinations. 15% back in July, all the way up to 50% presence by December. And that is a trend that is continuing through 2021 and is probably one of the most alarming trends that we are looking at in the last year or so. Benzodiazepines mixed with fentanyl. So completely shifting gears here. All that said, all that terrible news has forced really a rethinking of our approach in law enforcement. We are still engaged in enforcement and in policing the situation. As you may know, enforcement is one of the four pillars of the approach that the Canadian federal government wants the police to take. But what we really did in policing in the last couple of years is examine, other than enforcement, is there other things that we can be doing to help reduce overdose deaths? If we set aside the concept of trying to arrest people who use drugs, the people who are street entrenched, the people who are at the fringe of society to begin with and are suffering the most impact from a toxic supply of drugs, if we expand our efforts into other areas, what can the police do to help? And I'm proud to say that this has been something that I personally have been involved in championing for the last 5 or more years, because somebody deeply involved in the enforcement of drug interdiction, I'm not seeing the results that I want to see in helping to actually stop overdose deaths. So all that said, I want to let you understand that we have pivoted some of our response towards harm reduction. So how have we done that? Public education campaigns on the Good Samaritan Drug Overdose Act. So you've got I showed you the flyer there on the right side of your screen, and that is the flyer that's being distributed to people to indicate to them that they should not be afraid to call the police if there is a drug overdose at their location or they've witnessed one. They won't be arrested for possession. We discovered an impediment to people calling police was that they were for fear of arrest. And while many of us were long advocating that when the cops show up at a drug overdose scene, the last thing the cops should be caring about is who's got a point of heroin in their pocket. We don't care. But unfortunately, some police officers were not getting that message. So it needed to be codified in Canadian law, and thankfully it was. And so we're playing our role to make sure people understand this, that you should not fear arrest at the scene of a drug overdose. Cooperation agreements for overdose prevention sites. Again, I had the great pleasure of working with the BC Centre for Disease Control in creating the guidelines for police interaction with overdose prevention sites. And then what we do here in Victoria is we actually sign singular and separate agreements with overdose prevention sites so that we have a set of ground rules. When will the police show up? When will they stay away? What can they do to help us? What can we do to help them? By way of an example of a success story that I'm particularly proud of is that photograph that you see of that parking lot. That is the parking lot of the Memorial Arena here in Victoria, which was converted to a shelter after the onset of COVID. That white arrow is an inhalation site for smokable opioids and stimulants. The police vehicles are there because we share that parking lot. That is the same parking lot as the Victoria Police Headquarters. And we're particularly proud of the fact that we entered into a cooperation agreement with managers there and had virtually no problems whatsoever with this site. Maybe it was a proximity to the police department. In any event, I would go by on a regular basis and had so many productive and constructive conversations with both the staff and the people that were using the site that I spoke about this site with the Chicago Police Department and the police department in Cincinnati to explain to them that there is room for these sites in your community if done right. They can't be set on autopilot. It takes a lot of communication and cooperation, which BC has done to an outstanding degree. Naloxone distribution points. So we are many police departments are naloxone distribution points. Victoria Police were the first municipal police department to carry naloxone, and you see there the good sergeant himself photographed by the media. We have been using naloxone. I believe we are up to over 100 what we call saves or opioid reversals because of naloxone. And on this occasion, he had his photograph taken because we ran out of naloxone. We used it all. We had no more. I think they had to break down a door of a storeroom or something crazy like that in order to get more naloxone for the patrol officers who are going around using it to reverse overdoses. That's something that they're really proud of. We know naloxone is not the solution to stopping this overdose crisis. It's like a big bandage on an open wound. But the police officers that are able to reverse opioid overdoses rather than even turn their mind to arresting people, they're particularly proud of the role in saving a life on that night. So they're really happy to have it. And then the police have generally become are rolling out support for safer supply. I know this is controversial. We're mindful of diversion of safe supply drugs. We do see it. We don't see it at a level that is attracting a lot of police attention, but that doesn't mean it's not happening. Our attention is really focused on, as I've explained to you, fentanyl, heroin, mostly the benzodiazepine fentanyl combination. I put that photograph up of what some people might know as the MySite vending machine type device that has been rolled out across the province to provide opioids like morphine and hydromorphone to people who use drugs so that they can use a safer supply. So here's the thing. The police, we're looking towards medicine for help or for solutions to stopping people from dying. Maybe we're very optimistic. We're not particularly worried, like I said, about diversion, but diversion is a real thing. And so we're watching to see how the data kind of comes in. Again, often when you're in the situation, you don't know what it really looks like until, in my experience, until you're out of it looking back. And then the last thing that I'll talk about before I kind of close off and hopefully field some questions or we can have some discussions is something that I think has been a monumental change in mindset amongst the police. And that's the Canadian Association of Chiefs of Police support for decriminalization of hard drug possession. So I had the good fortune of presenting about 3 years ago at a police leadership conference in Vancouver, and I was on the committee that was organizing the organizing committee for the conference, and we introduced the topic of decriminalization. We had some officers who had been to Portugal. They brought back some of their knowledge. We put together some presentations, and we delivered this presentation and opened up the discussion to the chief superintendents of the Vancouver Police and the RCMP leadership, and just to get them to start thinking about, is this something that the police can support? We feel like we successfully planted the seed. I personally really not entirely sure what will be the outcome of decriminalization discussions. I've stopped pinning all my hopes on one particular course of action, but the idea is, because we're told over and over again, the criminalization is an impediment to people seeking help, seeking treatment. It's a causation for people using alone. And the stigma is so powerful that removing it might put a person on a path to treatment or access to safer supply or coming out and using an overdose prevention site. All those things sound like good things to me. I've seen so many people die from drug overdoses. I've seen the limitations of enforcement that when the Canadian Association of Chiefs of Police decided to support decriminalization, it was something that I could see a lot of merit in. So that is the end of my official presentation. I'm going to stop sharing my screen, and then hopefully, George, you can let me know if we have any questions or any comments.
So, okay, the comments are coming down. Can you guys hear me? Yeah, okay. Anybody feels like they want to unmute themselves and chat with Inspector Conor King?
Hi there, can you hear me?
Yes.
Sure can.
Hi, my name's Andrew. I'm calling up from the interior, and you're definitely the right guy to be presenting at this conference, and certainly admire your incredible work and leadership in the role of police in helping with this. But I've also come to see that, different communities and different police forces and different police leadership have different approaches, and not always kind of in the more supportive way that actually does a lot of harm in a community and really contributes to stigma and really contributes to a lack of services and fear of people doing the work in the first place. And then also recognize that there's other enforcement arms of municipal bylaws and private security, that it's not always a coordinated approach. So just wanted to ask your advice, how do we, when we go to our local governments and our local police forces, how can we advocate, to have learnings like yours and models like yours translate to other communities around the province?
Andrew, thanks for that fantastic question, and you really hit on something that is so incredibly important, and I wish I had a fantastic answer for you, but I myself constantly deal with this. So there is one organization that we use that reaches out to police departments across rural British Columbia and smaller cities and towns, and you might be familiar with it, Andrew. It is the BC Centre for Disease Control's Drug Overdose Alert Partnership. Now, why I mentioned this organization is because there is representation from Victoria Police, myself, from the Vancouver Police, from the Royal Canadian Mounted Police at a very high level. And the representation from the RCMP has a lot of influence with the police detachments, RCMP detachments across rural BC. And it is a good place for people like yourself to bring forward a concern. As of, for instance, quite some time ago, we, through that organization or through that basically partnership or committee or however you want to call it, we were looking at a situation where the RCMP in northern BC were actually looking at people who were carrying naloxone kits as a way to determine that this person was worthy of extra police attention. It bothers me to even have to say that. It's so ridiculous. But that was something that was happening, and I really understand that police have the same uptake of information that people in the medical community do. That is, what I'm trying to say is that some people are kind of early adopters of new ideas, and some people are late adopters of new ideas. And I know medicine is the same way. But this was an opportunity for using that partnership to reach out to the RCMP in this particular area and say, your efforts are counter to what your leadership is trying to establish here. There was a disconnect, I think, between the leadership and the guys on the front line. And it's not perfect. We have to be incredibly careful. You show up in somebody's backyard and tell them how to barbecue the burgers. You don't want to do that. But it takes a lot of diplomacy and gentle conversations, but they're worth having. So if you want more information about that group and how to use that group to come forward, to contact your local police, or I'll certainly keep in touch with you, Andrew, and if there's any ways that we can separately brainstorm on how to help your local police see things potentially a little bit differently, I'm always open to further conversation about it. I hope that sort of helps.
I'm going to try and combine a couple of questions, comments kind of thing. One is, what is the police doing to kind of build trust with people who use drugs? And at the same time, there's another question that I think will also could dove along, which is, what are things that influence that shift of thinking from the enforcement to the decriminalization and the support?
Okay, good questions as well. I'll just start with the second question. I'll start with the second question first, because the shift really has been, for those of us involved in drug enforcement, has been the sheer number of deaths. That was an awakening. In the years prior to the height of the drug overdose crisis, there was something like 250 drug overdose deaths per year in the province. And it kind of went unnoticed, sadly. It went unnoticed. And then, as things often are in life, not until you're smashed in the face with something do you realize that things are going really sideways. So for police, this awakening has been the sheer number of drug overdose deaths. And then for those of us who are working as specialists in the field, it's not just the deaths, it's also the understanding that for every death, there are dozens of non-fatal overdoses, and then this revolving door of treatment by naloxone reversal, and then persons back on the street and then using again. So we realize that there is a certain level of futility to the enforcement campaigns that we're doing, certainly at the street level, and there's utility in joining in harm reduction campaigns. So which leads me to the first part of the question, which is, how are we reaching people who use drugs? There's two schools of thought to that. One school of thought is that the cops should just stay out of the equation when it comes to people using drugs. We don't want to be an impediment. Like, we don't want to show up at overdose scenes and do what police tend to do, which is show up and think that we're in charge of everything going on. We're trying to get away from that mindset and let this be a health crisis and not let it be a law enforcement crisis or a police crisis. So that's one school of thought, hence the Drug Overdose Good Samaritan Act. The other school of thought is in helping to destigmatize drug use by being present in the conversation, being present in the equation, and telling people, even people who are using drugs, I'm not here to arrest you. So that was the approach I tried to take when it came to visiting the inhalation site next to the police department, as I mentioned. I wanted to normalize the situation. I wanted to be able to go over there in uniform, and I had terrific success. I think people just really enjoy actually having a conversation with police in an environment that is not threatening to them. So I went and had a lot of conversations with people to say, I'm glad you're using this site. How are you doing? How are you feeling? Here's an opportunity for you to get some stabilization in your life, to use somewhere safely. You're not going to be arrested. And I'm hoping that you're thinking about some access to treatment, or if not, be on your own path. And when you get there, you get there. I had so many of these really wonderful and heartwarming conversations. I don't want to sound too corny, that it was a hugely enlightening experience for me as well. So there are two paths. Some departments, the philosophy is hands off. Some is hands on. It's different from one place to the next. I think I see merits and detractors in both. Thank you.
There was one comment from Lloyd Main saying that 2001 is when the U.S. invaded Afghanistan. This is why there was a decrease in heroin. I don't know if that's a valid.
So 100% right.
Yeah.
100% right. That was Lloyd. Well done. Well done.
And do you think the first step is decriminalization, safe supply, or both simultaneously as a potential solution to the drug poisoning crisis?
Well, we already have safe supply in many ways. The evolution of safe supply could be access to diacetylmorphine or heroin. There's even discussion of safe supply access to fentanyl. I'm not opposed to the conversations about expanding safe supply, not at all. I just worry about the unintended consequences, which seem to really plague everything we do when we try to get a grip on the drug overdose crisis. As far as decriminalization, again, I'm a little worried about decriminalization in certain regions, but not in others. I think that could be at some peril. I wouldn't want Vancouver to see an influx of people who are coming there because drugs have been decriminalized there, and then put greater pressure on the finite resources that Vancouver already has to deal with this situation. I think it's kind of, we're all in or we're not in at all. But if we are all in, if it actually works to destigmatize drug use and people then do access all the things that we've talked about, overdose prevention sites or safer consumption sites, supervised consumption sites, safe supply. Most importantly for me, it's access to whatever is right for them at the time, whether that's treatment or rehabilitation. I'm told that the stigma is a powerful motivator to not get help. It's certainly, from my experience, a powerful motivator to use alone. And using alone, like that girl in the alley that I showed you the picture of, using alone is causing people to drop dead. So if people would reach out to their family and friends because they no longer feel that they're breaking the law, I have no problem telling people that I have somebody in my family who has a drug addiction, but their drug addiction is alcohol. And we've talked about their addiction to alcohol for years openly as a family. Would we talk about that person the same way if their addiction was heroin or methamphetamine or cocaine? I'm not sure that we would. And the whole point that I'm not sure that we would maybe speaks to the fact that why do we have this inhibition about decriminalization if it's actually going to save lives and make people feel more comfortable talking about what is characterized basically as a health issue?
Thank you. Okay. Mackenzie Clark wanted to acknowledge your compassion and human approach to addressing this crisis, and hoping that we see more people of enforcement officers with your attitude and approach.
Thanks.
Do you work with the investigative team approach, social workers, counseling, who are going on scene to provide integrated support?
Yes, I personally don't, because my current assignment has me doing other things. But we have a team of officers here at the Victoria Police Department called the Community Services Division, and they're the officers that are traditionally were beat cops, bike cops, community resource officers. Now what we do is we assign our community resource officers to work with overdose prevention sites, to work with organizations here in Victoria, like Kool-Aid Society or AIDS Vancouver Island, that are all involved in outreach efforts. So it's not always a seamless cooperation. Sometimes people still respond very negatively to the police trying to be involved in this space. And we have to just jump a hurdle. Showing up in uniform, people really are off-put by seeing cops in uniform come to committee meetings to talk about how to deal with people who use drugs. So there are hurdles to be jumped there, but I think we're making a lot of inroads in working in these spaces cooperatively. Yes.
Thank you. Kim Lloyd acknowledges the valuable information she learned from this session, and says that she will be sharing some of her knowledge today with others. I guess I would like to take the last few minutes to kind of ask you a question to just wrap up this. With the abundance of the local fentanyl and the purity of it, I guess you're not seeing, or you may be seeing still fentanyl-laced drugs, as we used to call it, more than, or you're just seeing people using fentanyl, pure fentanyl, and knowingly using it as well. And how is that shift happening on the street?
Yeah, that's a good question, George. It's funny, we don't really use the term fentanyl laced drugs anymore. That's just kind of slipped out of the vernacular. Now, all the people I knew who were heroin dealers, they're now all fentanyl dealers. But weirdly, they don't really call themselves fentanyl dealers. They still prefer the term heroin dealer if they were to call themselves dealers at all. But there has been, as I pointed out, a monumental shift away from the availability of heroin. So it is mostly fentanyl as the opioid. And I don't like to use the opioid of choice. It's not the perfect terminology in my books, but it is what people seem to be seeking out. Is they have become attenuated to the fentanyl effects, and that's what they're seeking out. So we're not really talking about fentanyl-laced drugs so much. There is occasionally that. We do use that term sometimes when we talk about stimulants like cocaine laced with fentanyl, or or methamphetamine laced with fentanyl, both of which we're seeing, though not nearly to the degree as we see it in the opioid supply. So yeah, it's kind of a term dropping out of the popular usage.
Okay, and I believe you had mentioned that the seizing of drugs is mostly now, I don't know, I don't remember the ratio of fentanyl to heroin, kind of, was it 6-1 or something? I can't remember.
Yeah, eight times more heroin seizures eight times more fentanyl seizures, I believe it was, than heroin seizures. This is something that I'm watching across the country on a continual basis because it has interesting global ramifications because we talk about this increase of heroin production all the way over in Afghanistan, but the market doesn't seem to be coming to Canada anymore. So it's probably going to shift somewhere else. Some other city or country across the globe is going to have a glut of heroin that no longer comes to North America because now we have fentanyl. And will Europe eventually have fentanyl too? And so heroin doesn't go there as much as it used to, or as much as it does now. Not to mention the fact that in a short order, the United States is going to pull out of Afghanistan, which is going to potentially change the geopolitical situation in Afghanistan, which might increase even more the opium production or potentially drop the opium production. That's something else that I'm keeping an eye on how that affects us. So it's all very globally connected.
Very last point, Andrew Kerr is asking you, how do you support yourself and your officers from burnouts and dealing with so much destruction, I guess, related to overdose deaths?
Oh, yeah, Andrew, again, really terrific question. This is an ongoing thing. I personally have been affected by the sheer number of overdose scenes that I've been to. We really look at the vicarious trauma that our officers are experiencing, and they're going to death after death after death. Thankfully, there has been an awakening inside the police community when it comes to resiliency, mental health, mentorship, coaching, looking after each other, looking awareness for signs that somebody is, in the yellow and in the red, and then making sure that they're being taken care of, their mental health and their physical health, and are being taken care of, that they have time off to. Basically, we talk about getting off the front line for a while and recouping and rebuilding that resiliency. It's a really interesting question, Andrew. We're doing a lot, but the overdose deaths, this is not a police story, but we are vicarious victims of the trauma, as are so many other frontline first responders and addiction specialists, because we're all suffering, and we should all be suffering together until we get out of this terrible situation.
Thank you. We are almost at time. Any last minute thoughts, any last questions before we conclude this session? Okay, well, I would like to thank Inspector Conor King for the time that you put in together for us today. I know that I've learned a lot from your presentations in different venues, so I want to thank you on behalf of everybody who was on this session with us.
You, George, and everybody listening are very welcome. I was happy to do it, and I hope that we can all work together to get out of this situation. So thanks very much.
Thank you so much. Thank you, everybody. I will be just ending the meeting now.